There's kind of a quote or an adage that's out there. The pandemic hasn't created cracks in our system. It's really just exposed the cracks that were already there in the first place. The inequities that are faced by those experiencing homelessness, who are disproportionately people of color, have only been made that much more clear by this pandemic. So our focus has really become, first and foremost, identifying individuals who have symptoms of COVID-19 and trying to get them into a safer place where they don't infect other people and they get the care they need, and also doing lab testing to try to identify people who don't necessarily have symptoms of COVID-19 but are in fact infected. So we're now doing upwards of about 1,200 plus tests per month. The background right now that I have up in this recording is actually of the testing team that was on site at the convention center about a month and a half ago. And in fact, that individual right there is actually from residential. So we even had residential team members supporting this. So it was a collaboration across many lines within the agency. But then in the midst of everything else, trying to figure out how to still deliver chronic disease management. How do we manage diabetes in this new reality? How do we manage COPD and do that remotely without people even having to come into our health center? This pandemic has really helped us to realize, as part of the silver lining of this pandemic, that a lot of our patients, even if they're experiencing homelessness, really appreciate being able to do a visit via phone or via video, and just really incorporating telehealth in what we do day in and day out. Housing is in fact healthcare, and this epidemic has really underscored that people cannot be maximally healthy, they cannot be maximally well if they don't have housing. Again, that's not just shelter, that's housing specifically. And reframing discussions about housing as not just a social issue, but in fact a health and healthcare issue. And I think we're going to see that message digested and understood and accepted as reality more and more so as we move forward.